Yeah, we are recording right now.
Perfect. Thank you. And we will, I presume that Chair Nicholas will be joining us momentarily.
Good afternoon, everyone. Hi. Can you hear me?
Yes.
Great. Great to see everybody.
Hello.
How's everybody holding up with the heat and the smoke and the fires? You're still here. I'm very impressed. So happy to see you all.
Is this a different Zoom link than the one that's posted on the website?
I don't believe so. I'm not sure. I believe it's the one certainly on the agenda. It is a different link than the one from the first meeting. But I don't know beyond that. I'm going to ask someone from IT to jump in if that is a question. And if that is the case, then maybe one of the IT team could jump onto the other link and send people over.
No, this is the only one we created for this meeting and for the coming meetings.
But I think Liliana's question is about the link on the Mayor's Commission webpage. I don't know if that one got updated.
Oh, that
I tried to join on that when it said waiting for the host to start the meeting. It ends with 1870.
Yeah,
I think this one ends with 4296.
Yeah, that's the recurring one that we made. I can fix that right now. Sorry about that. Yeah, I'll fix that.
And it looks like Chair Nicholas is trying to connect her audio. Is that right?
Looks like yes, I believe so.
Kim, your audio has a lot of static.
It wouldn't let me call in.
As a co-host, you should be able to call in.
I think you need to reassign her as co-host. I think she got disconnected, so she may not be a co-host right now.
Okay, I just fixed the website, so that should be fixed for the future. I'm sorry about that.
Is it possible though for one of the IT folks to open that Zoom though and just redirect folks for a few minutes?
I also got notified that people are waiting for the meeting to begin, so on the other side. And can we make sure that Chair Nicholas is able to speak?
She should be able to. I don't know that she's connected to audio, but she's not muted. But it looks like she might be having some challenges on her end.
So I just spoke to Chair Nicholas. She can log in, she can see everyone, but you cannot hear her, and so she's going to try again. So the problem was with her ability to unmute, apparently. So wait
Okay.
one.
Great, thank you. We will be starting very, very soon. Appreciate your patience.
So is that a setting issue, Paige?
It shouldn't be. It looked like she was able to unmute, but I'm going to defer to the IT folks.
Can we keep the chat option on during the meeting so that if people have questions as we go, someone can answer them rather than waiting till the end for public comment?
Are attendees not able to send a chat? My understanding was that they were, but I can't see that interface, so I'm not sure.
But just to clarify, we are going to be taking questions first from the commissioners, and then at the end, we'll be opening it up for the public comment. So commissioners, there's a specific time that we'll be asking for question and answers, and then there'll be another period where we'll be kind of in discussion mode, and then towards the end of the public comment from general participants. Does that answer your question?
It looks like one of the attendees was able to just send a test message for chat to the panelists. So I believe all the panelists, which are the commissioners and staff, should have been able to receive that. I was able to see that. Is that?
Yeah, we can see
Great.
the
Yeah, perfect.
And those definitely can be running. Great.
Exactly.
So I'm still getting a note that people are on another link.
So Daniel or Tony, I'm wondering, could you, it looks like you're still logged into the Zoom. Are you able, one of you able to go to the other Zoom?
Do you know what the link is? Can you email to us, whoever created that one?
I think it's on the city manager Zoom account.
I don't have a password for that one. If you log into the city manager's account and then email the link to support@ssf.net, please.
Marie, were you the person who said that you were updating the website, or was that someone else?
Katie did.
Katie, okay. So
Yeah.
Katie, could you either log in or send that to Gregor? Thank you. Thanks so much.
Yeah, no problem.
Okay. So I think we're just unfortunately waiting for Chair Nicholas to successfully connect.
Hello, can you hear me?
Yes, wonderful.
Oh, thank you. I'm so sorry. I usually log in early, but I have another meeting, so I'm really quite sorry. I'm so sorry again. Hi, good afternoon, everyone, and thank you for joining us despite the many competing priorities that we know you have right now. We hope that your families, friends, and community members are staying safe. I wanted to begin with a few follow-up items from our last, let's call the meeting to order for our second meeting, August 19th, 2020. Roll call, Edith Arias.
Present.
Jeff Asupardi.
Present.
Gladys Balmer.
Present.
Norm Faria.
Present.
Mike Futrell.
Present.
Cheska Basan.
Present.
Vanessa McGovern.
Present.
Hermes Monson.
Present.
Patricia Murray.
Here.
City Council Member Mark Nogales.
Here.
Carla Powers.
Present.
Liliana Rivera.
Present.
Bobby Vaughn.
Present.
Andrea Fernandez.
Present.
And I'm here, so everyone is present. We have a quorum. So before we begin, I just want to have some follow-up items from our last commission meeting. We will be making time for public comments at all of our commission meetings. In fact, even though we have a city council meeting tonight, and Council Mark Nogales, City Manager Mike Futrell, and I and Commissioner Norm Faria will need to leave right after or right by 6 o'clock. We have arranged for a consultant team or our consultant team to stay up to 30 minutes. That will be until 6:30 tonight to ensure that all voices are heard. I designate our South San Francisco Unified School District Board of Trustees President Pat Murray to chair the rest of the meeting to my absence. We also want to remind everyone of our group agreements. Please keep your comments focused on the Commission's goal. Let us find a common ground. Let us address the inequities in South San Francisco. This means this is not the forum for talking specifically about any political candidate, and we hope everyone will respect this. Also, from our city attorney, we checked them about the Brown Act. Brown Act is a set of rules that sometimes inform how public meetings are run. And again, as noted in the last meeting, the Commission is not bound by the Brown Act. We are committed to holding public meetings, and so the city attorney confirmed that the mayor's comments in the last meeting did not trigger the Brown Act. Another follow-up item is related to the request for a name change, and according to the city attorney, the Commission was formed under the authority of adopted City Council policy, and the Commission does not have the authority to change the Commission charter or the name of the Commission. So this Commission was established to identify recommendations that will be considered and decided upon by the City Council. I hope that you had some time to go over the minutes of the last week's meeting. So I'm sorry that I have to read the slides that were being presented. So it's regarding the minutes of last week's meeting. And before approving, there are additional edits to the August 8th meeting minutes. So the one that you have to look at is the one that was sent Was it around 2 o'clock today? That was sent by Marie. If you had a chance to read it, I would like you to either approve it by raising your hand or put something in the chat. Paige, I hope you can help me with this because I don't have visibility to other things. My connection is really funny. I don't see anybody.
Absolutely. So it looks like 1, 2, 3, 4, 5, 6, 7, 8, 10 approvals so far. So that is quorum and
I also approve it, but I don't have the raising hand.
okay. We will note that.
Very good.
Yes. Yes. Thank you for that. Patience. Okay.
So our goals for today is review the context. Oh, so what was the result? Was it approved?
Yes, approved.
Okay. So the minutes of the last meeting was approved. So the goals for today will be the review of the context of inequities in health and social services. We will also review the example approaches to addressing inequities. And we will have a discussion and preliminary prioritization of approaches for further investigation and hear public comments. At this point, I'll hand over the rein to Kim.
Okay, can you hear me okay?
Yes, we can hear you.
Okay,
I
great.
can hear you.
Okay, wonderful. Okay, so yeah, we wanted to just make sure to go over the agenda. We're really happy to have you all here today, despite everything that's happening and all of the competing priorities. As Chair Nicholas outlined, we're going to have a chance to take stock of what we were able to accomplish at our last meeting altogether. And then we're also going to have a chance to look at the context, the local context of inequities in South San Francisco and across the county. We have a couple guest speakers. And then we're going to look at an overview of existing health and social services and have a chance for commissioners to ask questions. Then we're going to have an opportunity to look at some example approaches to address these inequities in the area of health and social services. And after that, we'll have an opportunity to look at some perhaps initial actions or fast tracking of particular actions to address the inequities in health and social services. So just, I think we're familiar with this, but if we're having a hard time hearing, you can use the call-in number. And if you have a hard time with, unstable internet, you can turn your video off. And I think with comments and questions, the chat is available, so we invite folks to chat. And if you want to raise your hand when we have the open conversation section, we can do that. And I think that's everything. And then the last thing is just, as I mentioned earlier, yeah.
Sorry. Yeah. So for commissioners, we're inviting you to raise your hand just so we don't all speak at once. But you are able to mute and unmute. So try to make sure to put yourself back on mute so that there's not background noise when you're not speaking. If you've called in and you're a commissioner, you'll be able to use *9 to virtually raise your hand and *6 to unmute. Members of the public will only be speaking during the public comment period, although you can use the chat throughout or send emails to mayorscommission@ssf.net. And there will be a public comment period where folks can speak up to 2 minutes per person.
Okay. So just as a reminder, our last meeting, we the purpose of our last meeting was really to build a strong foundation, get to know each other, and kind of understand how we're going to be working together in this process, in this commission. And we actually accomplished quite a lot. We, as you'll recall, the commission approved the group agreements, and those include focusing on our common goal, building and strengthening partnerships and community relationships, being open to new ideas and perspectives. Will be, today I think is a great opportunity to bring that group agreement into play. I think we'll be listening and hearing a variety of perspectives. And then participate and be aware. I think, this invites us to make sure that we're hearing from a range of folks. So we also were able to approve, as you'll recall, the commission approved the guiding principles. And the guiding principles are intended to inform our work. So they'll be kind of our touch point. And those include recognizing systemic racism and social inequities, keeping those front and center in all of our conversations, support learning and innovation, listening for new ideas, making sure that we're promoting transparency, and then making sure that the final areas of change focus on action and systems change. So really wanting to make a sustainable difference in the lives of people of color in SSF. And the way we imagine doing that is by using the levers of change framework. As you'll also recall, the commission approved this approach, where we will be identifying programs, policies, and practices, approaches, culture, change that are ways that meaningful and sustainable change can take place. So as a reminder of the commission approval process, so just a quick refresher, if 8 of the 14 commissioners are present, then we'll have quorum and we'll be able to vote. That said, we are striving for consensus in this process, and we're hoping that most or all of the commissioners strongly support or can live with any decision. And so we are going to engage in conversation and dialogue, and are also, I guess, maybe now is a good time to say, limited by time and wanting to move to action. And so we'll be balancing all of those things. Okay.
Okay, so we're going to briefly go over resident demographics and some information about health equities before turning it over to the guest speakers that have joined us. So some of you, hopefully many of you, are familiar with these, some of these data already, but making sure that folks are on the same page. Since 1990, which is already 30 years ago, which is hard to believe, demographics in the city have shifted pretty significantly by race. The white percentage of the population or residents who are white has decreased from 45% to 19%. The percentage of residents who are Asian or Pacific Islander is increased from 23% to 41%. The Latinx population has increased from 27 to 34%, and Black and African American residents have decreased from 4% to 2% of the population. The population has also grown significantly in how many residents are older adults, so 60, 65 up, while the child and youth population has remained pretty consistent at about 1% of residents. Race ethnicity by neighborhood. As you, I believe, are familiar, Westboro, Downtown, and Winston-Salem are the neighborhoods in the city that have the largest number of residents. Westboro is predominantly Asian and Pacific Islander. Downtown is predominantly Latinx. And Winston-Salem is about a third each for Asian and Pacific Islander, Latinx, and white, while as the other neighborhoods are both smaller in terms of the number of residents and fairly split between mostly Asian Pacific Islander and Latinx. For languages spoken at home, less than half of residents speak English or only speak English at home. About a quarter speak Spanish at home, and then Tagalog and Chinese are the next most commonly spoken languages at home. And I know this map may be a little bit hard to see, but basically the purple areas in Westboro and downtown are the areas in the city that have the highest percentage of households that are linguistically isolated, which basically means that the household doesn't have anyone 14 or older who speaks English fluently. And so that means that it is more challenging for those households to get information about hazards, about civic engagement, et cetera, if it's not available in other languages. And so in those darker purple areas of the city, 30 to 40% of households are linguistically isolated, whereas most of the rest of the city has 10 to 19% of linguistically isolated households. For a few highlights of health inequities, we wanted to first lift up that I know that, especially with the Affordable Care Act, I think that many people think about healthcare and healthcare access and the doctor as being critical to health, and that is true. And when we were talking about health outcomes, which is where many of the racial disparities really show up most markedly, most of that depends on social and economic factors, health behaviors, which are very linked to social and economic factors, and then a smaller amount is due to clinical care and the physical environment. And racism very much shapes the physical environment where people can live historically and currently through housing discrimination, and where housing is more affordable, that's linked to social and economic factors in terms of employment discrimination and what economic opportunities people of color have, and where they're therefore able to afford to live. It also shapes health behaviors in terms of if people have access to parks or access to affordable healthy food, or if they're able to exercise because when they're not working multiple jobs. And then finally, there is plenty of institutional racism in clinical care as well that impacts the actual quality of care that communities of color experience when they go to healthcare settings. And then there's also typically less affordable healthcare available for communities of color, with especially notable barriers in certain places in the state. For life expectancy, this is within San Mateo County. So health disparities and disparities by race for life expectancy are common throughout the country and certainly throughout California. In San Mateo County, that is also true, with about a 9 to 10 year difference between the life expectancy for a child born in the county who's Pacific Islander or African American compared to a child born in the county who is white. And the city of SSF has a life expectancy overall of almost 3 years under the county-wide life expectancy. Where people live impacts people's health, and racism impacts where people live. As I mentioned, housing discrimination and housing affordability for decades, as well as in the current moment, really shapes where people are able to live. And as you can see, I know that the map may be a little small, but SSF, so South San Francisco, is right down here. And people who've been involved in the general plan update process may be familiar with the fact that east of 101 and downtown and Lindenville are all designated as environmental, by Calvin Virus Screen as environmental justice communities, where there is a disproportionate burden of pollution for folks that live in that area or people who work in those areas. And as previously mentioned, the downtown area is predominantly Latinx, and also one of the more populated places in the county. It is also one of it's in the 93rd percentile for air pollution in the state. In addition to air pollution and environmental pollution, the built environment and land use also impacts people's health. So one example of that is liquor stores. Liquor stores, the more liquor stores there are per capita and the more higher density it is, are associated with higher rates of substance use and alcohol consumption, also higher rates of violent crime, and other health impacts and community impacts. South San Francisco, as you can see for San Mateo County, not as high a density as Colma or Half Moon Bay, but 32-ish stores per 100,000 residents, with communities of color typically living in neighborhoods that have more alcohol outlets than white communities. And then we heard a little bit from Shireen Malik Fazali last meeting about the Community Collaboration for Children's Success in South San Francisco, which really focused on gathering community input from children, youth, and families who had experience or were at higher risk for having experience with the county's behavioral health services, juvenile justice system, or child welfare foster care system. And so predominantly, but not exclusively, youth of color and families of color. And these were just some of the mental health and substance use quotes from surveys and from conversations with community groups. And then within San Francisco Unified, there have been slightly gradually increasing percentages of across 7th, 9th, and 11th graders, percentages of students who are reporting that they've felt so sad or hopeless in the past 12 months that they stopped doing some usual activities. An interesting thing there is that because the percentage of SSF Unified School District students, only about 6% or so are white. So the survey that this comes from, the California Healthy Kids Survey, presents Asian students' responses and Latinx student responses, but not white students, to ensure confidentiality. And back to you, Kim.
Yeah, I saw a question from Liliana. We were going to hold questions for later, but if it's a quick question, maybe we could get at that now.
No, sorry, I can wait till the end.
Is that okay? Okay, just didn't want to forget it. Okay, thank you. Okay, so now I wanted to introduce the police chief, Jeff Azapati, who's going to provide a brief overview of police department calls related to mental health and substance use.
Did you hear me okay? Okay, so good afternoon, early evening, everyone. Jeff Azapati, your police chief. So what I've gathered for you guys are some stats that this group has asked for us to come up with. If you can go to the next slide, please. Okay, so as far as for calls for service, this actually is kind of a deep dive. It took a while. So we went back 3 years, from August 14th to 17th of 2017 to the 14th of 2020. So basically what you see is in the last 3 years, we've had over 10,600 disturbance type calls. Tried to make it a little bit easier for you to kind of figure that out, and so I went with an average per month. So that's about 282 calls for disturbances a month. A disturbance could range from a business owner's upset with a customer, two neighbors are arguing, a family argument, an argument at school, just basically anytime somebody calls us because they're seeing two people engaged in something that appears that it might turn physical or just loud yelling, and sometimes they end up being very minor, and sometimes they go to a higher level, but we have quite a lot of disturbance calls throughout the years. Next would be welfare checks. As you can see, it's about 108 of those a month. Welfare checks also kind of broad. That can be people haven't seen a neighbor for a few days. We get a lot of times kids that their elderly parents maybe live alone and they haven't talked to them, they didn't answer the phone today, and they answer the phone every morning when they call, and we'll go check on that. It'll be a report from someone, CPS, that there's kids that are possibly getting neglected and we have to go do a welfare check with them. Same thing, if someone feels that somebody in the home is maybe at risk, we'll get welfare checks for that. So those are not quite as much as the disturbance calls, but we have a lot of those as well. Next would be alcohol-involved calls, and these are calls that actually ended up being cases, which means we had to kind of fully document this call. We had 1,500 of those in the last 3 years, 42 a month. That's basically any call that involves alcohol. Skipping 51, the mental health evaluation real quick. If you go down to drug involved, those are also cases. What we have found, unfortunately, specifically in the last few months, and we're not sure if it's a result of COVID-19, but the calls with alcohol, drugs, and mental health calls have gone up. And that's, I think, just based on a lot that's going on, people not being able to work, people being at home, families spending more time together than they're used to, stuff like that. So those calls, you could see there on the right, alcohol about 42 a month, mental health evaluation about 30, and drugs about 26 per month. If you can move the next slide, please. I was asked to produce some of the training that is required for South San Francisco PD. So the academy, everybody has to attend an academy before becoming a police officer. That is 6 months long and has a bunch of different training topics throughout. Victimology, crisis intervention will be a 12-hour block in the academy. Persons with mental, physical disabilities spend 17 hours about that, and cultural diversity and discrimination about 25 hours. The academy is mandated through California. It's mandated through a company called POST. It's the Police Officers Standards and Training, and that is, like I said, it's kind of governed by the state of California, and they're the one that demand at least, I believe it's 880 hours, which is roughly 6 months. After the academy, they're in the field training program where they spend 6 months getting trained to become a police officer by themselves. Sometimes that is extended a little bit if the recruit needs a little bit more work, but generally it's a 6-month program. After they get out of that program is when we will start trying to get them into crisis intervention training. Crisis intervention training is a 40-hour block. They go for a full week. We are currently about 88% of our department has attended crisis intervention training. We have 2 actually in the city of Oakland attending today and tomorrow, and we'll be at 100% by the end of the year. Sometimes we're just waiting for these classes to open up, and then we try to send as many people as we can. But it seems like lately there's been a push on getting these classes going, which is good. So we will be at 100% of the department by the end of the year. We also have biannual tactical communication, which is what they used to call verbal judo, and it's basically just giving a update for officers biannually. I think it's 2 to 3 hours long, and it's just kind of reminders on tactical communication as far as trying to help diffuse situations and be a little bit more sensitive when you're communicating with people. So our crisis negotiation team, we have 14 members of that team. That team it's a 40-hour course. They have quarterly updates. That's an intensive course on negotiation in crisis. It has become very relevant in the last couple of years because of just kind of the uptick in cases where we've had to talk with people that were maybe threatening to hurt themselves or hurt others. This is sometimes aligned with the SWAT team, and you try to use the crisis negotiation team prior and hoping to avoid having a response that's a little bit more tactical. The good part about this is we've always put an emphasis on this team and try to get as many people, because these are all officers that do this when the need arises. Otherwise, they're in the station on the street working patrol, and we end up with more people with more training. So it's a good thing for us to have. These guys probably get more work on normal calls than they do when they're, quote, called out for some sort of a high impact case. So most of their time spent with their increased knowledge is on the street. And then we have what's called the county has a San Mateo County threat assessment team. One of our sergeants is currently the chair. And that's when anybody in the county could come forward to this group with maybe a subject that they're worried about. And that maybe we've gone to that call for a mental health, they've been in a mental health crisis 2-3 times, and we're concerned that this might escalate and maybe the family's in danger. We bring this person's file to this team. This team's a combination of sworn and civilian individuals within the county, and they get together and try to figure out the best way to try to get this person help. Next slide, please. Okay, last is our downtown bike patrol. So just so you know, we have 2 full-time downtown bike patrol officers. They are assigned, like I said, full-time. They're 2 years. They're offset in their deployments to their team. That way, we always have a downtown bike that has an appropriate amount of training when we get a new officer on. This team was initially actually only 1 officer, and generally they went up and down the downtown corridor, talked to businesses, talked to people that were shopping, dealt with any issues, sometimes parking complaints or dumping complaints. And really, as this position has evolved, about 5 years ago, we made it 2 officers as we started seeing just a huge uptick in transients, in homeless, in transient encampments. And this group of people now spends almost 50% of their time going around and building relationships with our transient community and our homeless population and trying to get them services. As you can see here, 3,500 people roughly were contacted in the last year and a half, with 2,275 people. That's 65 people, 65% of that 3,500 were offered services, whether it be clothing, food, hygiene, or job assistance. And they do this, and they're partnered with the San Mateo County Homeless Outreach Team, which is affiliated with Life Moves. In this same time frame, 18 months, 72 people that we contacted, that the downtown bike police officers with Life Moves contacted, have been provided with services and have been housed. And these 72 people, if not for this group, would potentially not be housed, would still be on the street, because there are not other groups out there going out there and contacting these people. We're doing it, and we're not writing them tickets. We're not creating cases for dumping or littering. We are contacting them, finding them services, and housing them. I'd like to add, if anybody has any questions about the success of this program, please reach out to the people at Life Moves with San Mateo County. I ask you to please ask to speak with someone with the homeless outreach team, and ask them about the success that they've had working with our downtown bike patrol. I think they have a lot of great things to say, because they've seen so many people get services. Next issue that was requested were 5150s. That's a California code for that particular situation. What the criteria is that a police officer has to respond and decide if this person is a danger to themselves, to others, or if they're gravely disabled. What a lot of people don't realize is there are two sets of people that have the authority to do this. And this is a California law. So for those that don't think police officers should have this ability, I ask you to take that up with the lawmakers in California, because they're the ones that deemed us with this responsibility. And that's to place someone on a 72-hour hold for either if they're a danger or deemed a danger to themselves, to others, or gravely disabled. These calls, unfortunately, are on the rise in our county, and that's per the county, per fire department sees it, and we have seen it since the COVID pandemic. It's been an issue that we deal with a lot. It's very hard. Oftentimes, you place someone on a 72-hour hold, and they are out 24 hours, 48 hours, and they're back on the street, and oftentimes we're getting called for them again. We occasionally happen upon someone who might be in crisis, specifically if they're transient, but generally these are calls for service. These are our families that are calling us because they have children or a partner that is in a mental crisis, and they're worried about them. And we go out there and try to figure out how they're doing. Oftentimes, it's just someone having, say, a bad time. They're not a danger to anyone, and they stay in the home. But unfortunately, there are times, based on just the danger that we want to try to avoid, that they are placed on a hold. Our concerns that we have, I think our concerns that everybody has, is the amount of contacts, the amount of people that are homeless right now. Of those homeless people, I would say, or transient individuals that we contact, probably 95% have a mental illness or are narcotic addiction. And what that has caused is us to change the way that we approach these calls, us to work with our partners within the county, and it's all about trying to get them services. It's not a proactive, it's not a police approach, it's more of an approach to try to get them help. And it's a long process. A lot of these people don't want help or don't think they want help. And we have the county folks that are the experts, talk to them, and we try to just provide whatever support that they have. Just to wrap this up, I just want to let the group know, the commission know, and everyone else that might be watching. There's a lot of programs that work with police departments in trying to contact people that are going through mental crisis. There are no programs that do that do not have a police officer involved. And that's frankly because clinicians and other medical professionals prefer not to, or are not comfortable contacting these individuals without at least a police officer present. So we're hoping that we can move forward with the county and find other ways to be successful, like we have been with the homeless outreach team through Life Moves. That is all that I have for the questions that were asked of me.
Thank you very much. I know there's a number of chat comments and questions, and I'll just say a couple things, and then we're actually going to continue with additional presentations, and then we'll have some time for question and answer at the end of that. So we're tracking your questions. We wanted to start really with the specific questions that we've heard from the charter and from the commissioners related to mental health and police calls, but also wanted to have it step back and take a look at the overview of a range of services that exist, both for the county, but also for South San Francisco. So you'll be happy to know I'm not going to go through all of these right now, But this slide is really to show the breadth and depth of services that are available. You can see in the top left corner, the city of South San Francisco specifically offers those health and social services. And then there's a number of different government agencies that provide a range of services which are listed here. And I'm sure they're not, there's so many programs underneath all of them. What we wanted to do next, on the next slide, is just indicate our next guest speaker is going to be focusing on San Mateo County Health programs and services. And so with that, I'd like to introduce Srija Srinivasan, who is the Deputy Chief of San Mateo County Health. She's going to provide an overview of those services.
Good afternoon, almost evening. I hope all of you are staying safe in this swirl of challenge within challenges. And for those of you who I have not met, my name is Srija Srinivasan. I'm Deputy Chief of County Health. And I believe I have about 10 minutes on your very busy agenda this evening. So want to hit the mark, and I believe you may already have received a fair amount of context, and make sure that you have the time that's most important to you. So next slide, please, Paige. Our mission at County Health is longer and better lives for everyone in San Mateo County. And we see equity as absolutely central to achieving that mission. We're really grateful for the leadership you all are playing as a commission, and for those of you who are joining this meeting. I believe you already saw some statistics that the RAMI team shared about the health burdens not being distributed equitably in our county. We have gaps. We have work to do. We need all the minds and hearts and person power that you all represent to have more equitable opportunities, because we see the burdens by place, across our cities, within cities. We see them by race, and that the color of our skin continues to matter in the outcomes that we get to enjoy, and of course by economic factors. So next slide. At County Health, and I believe the chief also alluded to our partnerships with the city law team. County Health has partnered with the city and with leaders from South San Francisco and with the residents of South San Francisco for as long as I've been a public servant, which is around 20 years, but well before me as well. I hope most of you know of our physical presence there at Grand and Spruce at our medical clinic, where we provide pediatric and adult primary care. We also provide a federal nutrition support program called WIC, and that a medical home ends up being a hub for lots of other important connections, because one's doctor is still a really credible, trusted source of not only medical care, and that's only part of the health equation, which I think you also heard from Paige, but also other supports that might be necessary to be able to overcome barriers in our lives. A second key area in which we've partnered county, city residents has to do with health insurance and health coverage for all. Do we have as equitable of a health insurance system in our country as we would like? No, not yet. But across the city, from the city's headquarters at 801 Gateway, is the Health Plan of San Mateo, which is a really critical health insurance partner and manages the public insurance programs like Medi-Cal, which is health insurance for our lowest income residents. And we also have worked with the city, including directly the city staff, around adult daycare and transportation support for older adults, and certainly also in the mental health arena and in substance use treatment. One of our major community partners, Health Right 360, is a lead on prevention efforts targeting South San Francisco. And I looked at the participant roster as I was trying to multitask and recognize some names, some many decades like Valerie, but whether it's Parks and Rec or libraries or the Community Learning Center, we just really appreciate the longstanding partnerships that we've had with the city. And I think you've already heard, and I'll talk just a bit more about our community collaborations for children's success effort. Next slide. So when COVID-19 came to our shores, earlier this year seems very long already to me as a public health professional. I think some thought a pandemic might give us a great equalizer, that when we have huge challenges like a pandemic, like a epidemic, we're all vulnerable. We all have to live with those risks. But what we're learning and really just grappling with is how much COVID-19 is exposing underlying inequities, these same burdens that we just mentioned. And we have 7,321 lab confirmed cases of COVID-19. This is a screenshot of the dashboard that gets updated daily. And this is only in a matter of months. So many of you likely know this is already the third leading cause of death in the United States. 7,000 cases, in just a few months in San Mateo County. And it hasn't been the great equalizer. It's actually exposed these underlying burdens that some people are more exposed than others. The Latinx population is almost 50% of the cases, while representing about 24% of the countywide population. The South San Francisco Latinx population is a greater proportion. We see the burdens that come with doing work that puts people at exposure with other people, the people that don't have the privilege of working from home, the people that are working at a lower wage and don't have the stability of hours, and the same people that might also end up living in more crowded housing situations in this very expensive housing market that we all find a way to make work if we're lucky enough to live in San Mateo County, or grapple with if we're commuting to work in San Mateo County. So though the COVID-19 patterns have actually pretty much mirrored the patterns of being lower to moderate income in San Mateo County. And at this point, we're seeing with great concern ways that the disease and the pandemic could exacerbate rather than equalize the inequitable conditions that are in our community. Next slide. So as we think about that challenge and, how do we envision a next set of actions that we can be taking that prevent the equity gaps from growing? Think about a new normal, not a return to normal. We do see opportunities. Those opportunities are shared ones. None of us, public health is a team sport. And, every day we're humbled by the challenges that our residents are experiencing. I think you heard from Shireen, so I won't spend a lot of time on the first bullet of what the priorities of wise leaders from the South San Francisco community lifted up as priorities for our young people. What are the ways that our young people can have more support and more trusting environments in the ways they live and the way parents experience the challenges of creating the best possible future for their kids. We're also seeing in our COVID-19 pandemic response a lot more visibility of those who never thought they would be relying on a safety net, who didn't think that security or safety would be a concern they would have to overcome. One of the key programs that's been mobilized just in the last couple months is the Great Plates program that's involved many restaurants. I believe in South San Francisco we have, 9 local restaurants, as well as 385 residents who've been served more than 63,000 meals through the Great Plates program that San Mateo County and you as a partner city and the restaurant sector, this has put back about $1.4 million in the economy just in South San Francisco. And we see in the story, we hear in the stories and we see in these experiences, what it's like to be close to the margin, maybe not relying on a safety net, but very close. A second area that's become more visible has to do with what is the set of wraparound supports that safety requires. There are hotel rooms that have been mobilized, there's housing supports, there are healthcare supports, but sometimes the wraparound to just support the whole household unit, the family that's sharing resources and making it work, has to get supported differently in these kinds of challenges. We're very aware as a public health department that achieving equity is a long haul. It's about people for sure. I mean, and the relationships that we have with some of you, maybe not all of you yet as deeply as we want to, but also about the systems and structures we're working within and what can we as people influence through the roles that we play, and what policies can we further that can change the balance of the equity equation so that it is more just, because more just ends up contributing positively to health as well. So I think that is what I plan to cover with you all. I want to just give gratitude to each of you. We really appreciate all that everyone is sacrificing through these very difficult times. And we want to be a resource and a partner to the commission and to the next steps that might be forged together.
Thank you so much. I really appreciate that overview. And I was just thinking as you were talking, Srija, and also Jeff, in terms, you know, it's a tall order to summarize all that there is, you know, in 10 minutes. So I appreciate kind of the nuggets that you offered. And I also recognize that there's a lot more to be said. So we have a little bit of time right now, about 10 minutes, because we are trying to keep moving things along, to ask our guest speakers any questions. There's a number of questions that are on the chat, but maybe if we could have hands from the commissioners to give us an idea of who might want to ask a question. Commissioner Mark Nogales, I think you have a hand up.
First of all, thank you to both our presenters. The data is really, really important. Chief, can you, in terms of our homeless population, I know we do every year a homeless count. Do you know if it's gone up in the last couple of years? I'm just interested to find out what our numbers have been in the last couple of years. And I have a follow-up question after that.
I don't have the numbers in front of me. I know that they've gone down. I'm not sure, I don't want to put them on the spot, but my boss, I think the city manager, knows those numbers pretty well.
At the last count, it was 42.
42.
Right. They have gone down 5 years ago when we started the HOT team and started putting mental health professionals in Bound Pump Bike Patrol. We had 177. So the last count, as noted, is about 40. And it's been successful to collaborate and put those different professionals together in a coordinated effort.
Great, thank you. And in terms of, I know there's been talk about having mental health services, social workers to come out with police officers. I'm just wondering, what are the barriers you think that would prevent that from happening? I mean, I'm pretty sure there's economic, financial issues that we could probably talk about, but I'm just wondering from your sense, what barriers would there be if we were to, say, have someone from the county to work with a police officer on their patrol?
Well, I think you hit on it. The barrier would be economics. It would be the county and the city coming together to fund it. For us, there wouldn't be, I mean, we do it already. We do it with our downtown bike group. So we kind of already used to the model, and we're open to it. The only thing that I want everyone to know is that every model that you look at always includes a police officer. And that's frankly because the mental health workers or the clinicians are not comfortable going to these houses or contacts alone. So to me, besides the money barrier, which is the big one, we're more than open to all of that.
And they don't want to go alone because of their safety, I'm assuming, correct?
I just don't think they want to contact people out on a train track, for one, in a transient encampment by themselves without a police officer with them. And I absolutely don't blame them for that. I don't think that is safe. But when it comes to, just so you know, you'll have 2 downtown bike officers, and they'll go out and they'll contact a transient or someone who's homeless. and they start the conversation. We call for life moves if they're not already with us. They come out and the officers step back. And then the conversation and the services and everything is really ironed out between the life moves employee and the individual that we're trying to help. And it's very rare that this gets solved the first time they meet. They need to start trusting us. There needs relationship building. It takes a while, but it's successful because it's a combination, and the person realizes, hey, these are services that are being offered to me. And after the suspicion of the whole situation gets cleared through based on the relationship, that's when we get positive movement in housing these people. It's really the combination of us finding them, providing that the contact can be safe for the mental health professional, and then being there with them while they do their thing. They're the experts.
I have more questions, but I want to make sure.
Okay, we have a, well, yeah, thank you. Thank you. I think Liliana, Commissioner Liliana, you're next.
Hi, thank you. I just wanted to say that I think it's pretty telling that this is supposed to be a meeting about health and social services. I don't think the police department is supposed to be either of those, so I don't know why we're once again turning to them to fill in the gaps where the city has failed to provide a social safety net. So I just think that it needs to be emphasized that South San Francisco needs to have their own programs, not just for responding when things get out of hand, but also for preventative measures. Because if somebody, is having mental health issues, but it's not to the point that they're having a breakdown, why would they think that they could call the police to help them with that?
I don't. Is that question for me?
I guess it's more of a
no,
comment.
I think, yeah, it's a comment. I think Commissioner Kaler is next. Commissioner Kaler, would you like to ask your question? Okay. While we wait to see if we can get a hold of Commissioner Kaler, Commissioner Mike Futrell, would you like to speak?
Yes, thank you. And I can appreciate the comment that was just made. We do need more effective and better mental health at every stage. But it's my understanding that by California Constitution and the way it works, that duty actually falls to the county to administer. And I appreciate they spend about $150 million a year on mental health. County government does, and that covers all the cities. And I do have a question for our county representative in that vein. And I will just point out, $150 million is way bigger than our whole city budget for parks, for police, for everything. So county has billions of dollars. From the county side, do you have a program that was just described by Liliana where you do have preventive services? We're kind of at the tail end at the city when somebody calls 911 because something bad is happening. Does the county have those proactive programs? And how do we get more of those in South San Francisco?
So Commissioner Futrell, nice to meet you via a public meeting. So we have a range of supports in the mental health and behavioral health field. We do have a robust budget. Most of that is actually paid for by the federal and state government, and it flows through insurance like MATEO. I don't know enough about the specifics of the layers of protection that we're striving for, that the commission is striving for, and the role that a mental health clinician can play to give an off-the-cuff answer. We appreciate the long partnership we've had with the city, and happy to have our behavioral health director, Scott Gilman, or one of our other behavioral health leaders come back to share some additional information. We need to look at resources and need and equitably figure out the most effective ways to build trust with the community. And most of the factors that lead to homelessness, lead to mental health challenges, have roots that are in advance of the homelessness situation. So I'm not sure what type of answer you're looking for on the spot.
Well, maybe just through this commission, we can continue that dialogue and understand what preventive services are already being made available by county, or the money you mentioned maybe could be redirected to that on the street level. And then how do we in South San Francisco make sure our residents are getting the most out of that? So for me, that would be
yeah, happy to provide more information. I'll just say that most of the money that is in the behavioral health and recovery services budget is not a discretionary lump sum. It comes with rules that come from federal government mainly about how that money can be spent and how it can be deployed, but we always want to use it in the way that provides the best value to the resident, and especially our most vulnerable residents.
Yeah, because I think I'm correct. In the county, if there were a mental health crisis where someone would dial 911, I think in every city, the county expects the police to be the first responder and figure out what's going on. And then and in 5150, I think that those individuals are actually then taken to you, to your
well, on a 50, yeah, so 911, absolutely. The dispatch system flows through law enforcement and through the city infrastructure. For there is a specialized SMART team for 5150s in which it looks like a mental health intervention might be the most effective. That has a different path, and could talk more about that one. Other preventive supports, it depends if you're a child or an adult, if you're an older adult, and other layers. So I think I'm coming into the conversation on meeting 2 not knowing what all is being asked.
Okay, well, we're trying to figure this out too. Thank you.
Yeah, thank you. I think there's a lot of questions and perhaps a lot of investigation. I appreciate the idea of maybe bringing in a couple other folks based on people's chats and what the comments are. Can we, there's another question from Commissioner Edith. Go ahead.
You mean the one I put in the chat, or you asking me if I have a question?
Do you want to go ahead and read the one that you have in the chat?
Yes, I was asking in South San Francisco, so directly whether they have insurance or not, if our city provides any mental health supports in a ways of, I just heard about the clinic, but I mean, if we needed to refer someone, if we know someone who's going through, you know, it's more like preventive, right? They're not in the moment where you have to call 911 or it's not a 5150, but you can see something's going on and they need that support, because then it will lead to that. In South San Francisco, is there a place, is there someone we can just refer? And I say local because many times as we saw all the information that how in the downtown area, a lot of these families might not have transportations, might not have the language, you know, there's language barriers. So that's my question, if within the city, because I might not be aware.
I can try that. The short answer is the city does not provide mental health services as a city function. We rely on the county as the health agency for the county, and we would refer those individuals to county. For example, there's a mental health clinic at the county mental health clinic at the corner of Grand and Spruce in that medical clinic. But maybe where we need to focus is how do we let residents know, and then how do we make sure that South San Francisco is getting 100% of what we're due from the county in this regard, and do a better job of connecting residents to those services. So I hope that helps.
So and I would just add, Commissioner Arias, sorry, I don't want to interrupt.
Well, I just wanted to confirm, so just one clinic for South City, just one.
Yes, we have one medical clinic that's county operated. Kaiser South San Francisco has a presence. Other medical organizations have a presence there, but as a county operated clinic, we have one. Not all of the 21 cities have a clinic, and we're very proud to have partnered with the city to have a clinic presence in South San Francisco. For most mild to moderate mental health concerns, the first call is to the person's health insurance. And I think that it seems unfriendly or not localized. And a lot of communities, we heard this also in the CCCS feedback, that it would be really nice if all of us could have a mental health support system in a way that we perceive mental health, not the way the insurance companies organize mental health, that's actually not how those services are typically organized. And so I think we have to just keep in dialogue and keep striving for what's possible with the resources and the rules and the constraints that come with money when, for example, the money is funneled through insurance programs.
Right, so we're sort of unpacking the web and the complex factors, but, you know, really want to lift up the basic needs that you're talking about, right? So like, how do we connect the web to the person and make sure that the community members are, in whatever language they need the support, getting the services. Can we hear from Commissioner Hermes? Commissioner Hermes, are you? Yeah, there we go.
Yeah, can you hear me?
Yeah, go right ahead.
Yeah, I have a question. Is there any levels of the police officers when they respond to a call or when they're patrolling any neighborhood? If they see something that looks suspicious, do they have levels of how to approach the situation, or they see that happening, especially with teenagers? I have a specific question. If a teenager is doing a wheelies on the block that he lives on, and this officer, would he come full board and put handcuffs on the teenager, or he will try to engage to a courteous conversation with the teenagers, looking for some mentoring to them, looking why they're doing that or how they should do it? I would like to know if the police department has different levels how to approach different scenarios, especially with our youth, because I have this specific question. It happened in my block, and I wonder if this teenager, when he becomes an adult, will have some resentment against the police department already without having an opportunity to actually know some good officers. I did ask this before and had no answer, so I would like to maybe our chief could respond to this question.
Yeah, it's a difficult question just because there are so many different parts of the scenario. There could be so many different scenarios. So just with the example you gave, someone riding a bicycle, doing wheelies. I don't think that would be a situation unless if the kid was not wearing, he was a juvenile not wearing a helmet, the officer might get out and advise him to be careful, or he needs to wear a helmet. It depends if there was a call for service, somebody called and complained that this person was riding in the middle of the street and was afraid they were gonna get hit by a car. Every contact should start with a conversation. Hey, what's going on? You know, this is why I'm here. Is there a reason why you're not wearing a helmet, or is there a reason why you're riding in the middle of the street? And what I always hope, and I'm not saying it happens every time, but what I always hope is that there's a conversation, you try to figure out what's going on, and you try to turn it into an educational thing, where maybe at the end of the call, the juvenile feels like, okay, well, you were either called here or you were stopping just to check, making sure that I'm ultimately doing what I'm supposed to do, wearing a helmet, being safe, whatever the case may be. Now, there are all kinds of different things that after that contact could happen to lead this person getting into handcuffs, I suppose, but without having any other suggestions or knowledge of what happened, I would say no. Generally, you're not going to put handcuffs on someone who's riding on the bike, riding wheelies on the bike. Now, maybe that kid that you contacted with has a warrant or something out of from the county. Then yeah, you would put him in handcuffs and potentially, take him away. And it all started with him riding wheelies, but it led to the fact that he has, a prior problem. But do you see what I'm saying? There's just so many different variables. Ultimately, what I hope every contact leads to is some sort of a positive relationship. I know that doesn't always happen, but that should be the goal of my police officers every time they contact somebody. You know, you're not going to that's not going to happen 100% of the time, but the more you can turn that contact into something positive, the more better chance to create a relationship, the better chance to have more community involvement with the city, with the police department. So the goal would be absolutely.
Thank you. Thank you very much. I just, I think it sounds like, again, a complex relationship, and thank you very much for responding to that question. We do have a couple more things we want to present to you that are actually very related to these comments, but I thought maybe Commissioner Gladys, I know that you work in, I don't know if you had a question or a response that you wanted to provide to the committee, to the commission.
Yes, it's more a question. It's related to the type of cases and incidents with the slide that it was shown earlier for the responses from the police department. So my question is, so you show a 3-year average per month, and I was wondering if you have a point of comparison for communities that have the similar demographics than South San Francisco. How do those numbers compare to other cities with similar demographics?
So is that for the police chief?
Yes.
I'm sorry, I was trying to look at the questions in the chat. Part of it was cut off. What was the question about the demographic?
So you provided a slide on the type of disturbances and cases that you have, and you say that it was difficult. I think I remember you saying that it was difficult to get this data. I was wondering if you have points of comparison to see how the San Francisco Police Department is doing compared to other cities that have similar demographics.
Yeah, I don't have that data for you. We would have to go through 10,612 calls and try to break down by demographics. And frankly, you know, we just don't have the time to do that.
Okay, but do you look in your in the way you see kind of these reports? Are you looking to see how are you doing compared to other places or trends even within, for example, you say that there was an increase in the last few months. Are you looking at these trends to see how are you doing?
Yeah.
Or how
Sorry, yeah. So all I can say, and I don't want to be too long about it, San Mateo County, at every level within our departments, we have communication with each other and we have groups of communication. So we're constantly talking about different trends because what's happening in South City is happening up and down the peninsula, up and down the county, up and down the state. So we're always talking with our partners and trying to figure out the best ways to combat some of these issues. A call like a disturbance call is just very broad, and every city is going to have disturbance calls. And based on probably the population, the size of the cities, you're going to have, San Francisco would have way more calls obviously than we would, and we would have way more calls than say the town of Colma would. But yes, we are constantly talking with each other and trying to figure out the best ways to be successful as police departments.
So Chief, let me just quickly, we can move on. We do track major crimes over time, and we can provide that to the commission prior to our next session. We'll email that out to all the commissioners.
Thank you. And, you know, I think we're sort of balancing trying to provide key information to help you identify some possible areas of change. I know there's a lot of questions. I think what we can do is keep track of the questions and at the same time keep moving along. And if we don't answer all of them, we can get back to you in as much as we possibly can. I think with that, we wanted to provide an overview of example approaches, many of which touch on what we've talked about so far actually in the presentation and in your questions. So Paige, I think I'll hand it over to you.
Thanks. All right, so not surprisingly, there's a lot of potential entry points. So there's lots of opportunities to make meaningful change, and part of, I think the commission's hardest job is really going to be to figure out where to focus the recommendations and what's going to be most meaningful for reducing racial inequities or other inequities in South San Francisco and for South San Francisco community members. One of the things we want to kind of keep in mind in addition to the levers of change is really what sort of results we are looking for. And so we have, we'll be going through in each of the topic meetings, the next 3 ones, as well as this one, kind of what sort of approaches will achieve shorter term results around racial inequities and some which will achieve longer term results. Just so we can keep both in mind. I know there were some comments from commissioners on the 8th around wanting to see results as soon as possible and also wanting to really address systemic change and not just kind of shorter term things. So with that in mind, shorter term results for racial inequities in health and social services typically involve reducing barriers that keep people of color from using available resources and services. And those may not be intentional. Those are often unintentional, but they nonetheless disproportionately impact people of color. So things like what documentation is required to participate, what languages services are provided in, stigma that may be present in different communities or cultures for what kinds of services are provided and how things are explained. And then longer term results for racial inequities in health and social services include decreasing disparities in chronic disease conditions. So that could be reducing the gap for life expectancy for people of different races or ethnicities in the county or in South City specifically, or reducing rates of diabetes or dental oral health disease, and then also decreasing the need for emergency health and social services ultimately. So while there are many services that we really want people to utilize, and certainly we want people to utilize resources that are supportive for them, regardless of whether they're emergency or not, we also recognize that there are, in an ideal world, services that people would not need to use. So ideally, people would be getting preventative care, so they wouldn't need to go to the emergency room for things like tooth abscesses or the things that could be treated through earlier interventions. Similarly, if people actually were working, or if jobs paid living wages consistently, people wouldn't need to have access to food stamps, for example, if they were actually able to afford and make ends meet based on the income that they had. And so these are 8 example approaches to reduce racial inequities in South City. They are really examples. We have no doubt that there will be many more examples that will be considered by the commission. And we also are assuming that in phase 2, we will be focusing in on a pretty small number of approaches that we both want to have address health and social services inequities, as well as the other kind of topics that the charter has been tasked with, the charter has tasked the commission with rather. And some approaches may address different kind of topic areas because those topics are so related. So this presents the levers of change that we had approved in the last meeting. So the toolbox is programs, the little wheel cogs are organizational culture or approach, and then the little bill is policies, and then just an indication to try to give a range of possibilities, some longer term, some shorter term approaches for results, and then a few that have potential results, both long term and short term. And let's see, sorry. And these strategies in particular are all either evidence-based or promising practices, and they also come from the Community Collaboration for Children's Success. Some of them come from the Community Collaboration for Children's Success and Change SSF's recommendations. So just wanting to lift up kind of things that have already been discussed in the community. And we'll go into this in a moment. Kim, did you have anything you wanted to add this moment or before we move into the discussion?
I don't think so. I think we just want to have an opportunity to hear from the commissioners and maybe ask questions, go through each of the examples. So particularly with example 1, actually creating a response team for mental health crises, substance use, and homelessness focused on utilizing conflict management. I think this particular recommendation did actually align with both the Community Collaboration for Children's Success action item. It also aligns with one of Change SSF requests. And it also, based on what I've heard today, aligns a lot with many of the comments that I've read and that you've talked about. So I'm curious in particular what you all think about, talking more, investigating, exploring some of the ideas that were brought up in terms of identifying resources that could be collaboratively pooled to create a mental health team. Okay, so I have a number of hands that I see. I'm going to look for a hand that I haven't seen go up before first. I don't see that, so I'll start with you, Commissioner Liliana.
This is just a suggestion that I had. I think number 2 and number 3 on this list are super important in terms of reducing the need for after-the-fact intervention. Something I think is really important that came up during one of our housing meetings was the definition of low income or underserved. I know that for housing, the median income, which is used to define the low income, is done on a county level. And because we're in such a wealthy county, but we're more of like a working class city, I think that really does the people here a disservice, because the amount is so much, it's so overinflated because we're lumped together with cities like Hillsborough and Woodside and Atherton, which have much, much higher incomes in South San Francisco. So I would like to see this based low income on specifically South San Francisco income.
And just to clarify, Liliana, you said 2 and 3?
Yeah, or really any preventative program that has a check for income level. I think it should be the city income, not the county income.
Thank you. I think Commissioner Mark, you were up next, and then Commissioner Mike Futrell.
Great points. I wanted to kind of also talk about number 1 in terms of creating this response team. I think we really need to hear from the local organizations that have been part of this as well, from like CORA, Asian American Recovery Services, Life Moves. I mean, they need to be part of this conversation in how we can serve residents who are affected. I think they can bring a lot of insight in terms of what we can do, what we can improve on. So I would be in favor of having them come and help us guide this conversation.
Well, that actually, let me just make a comment before we have Mike speak. You know, today what we're trying to do is get a sense of what we're interested in, which example approaches might be interesting to pursue more. And there's lots of questions about any one of these. And so, you know, the way we've structured our meetings, and I'll just maybe mention this now, is that for each topic, we're going to have some relevant information, some, you know, speakers that provide additional context, and then we're going to be presenting some example approaches based on local community input, et cetera. And so, you know, if you all say, we really want to find out more about 1, 2, and 3, then we'll take that back. And then at the end of all of our sessions on particular topics, we'll look at all of them and go through a prioritization process, because we're not going to be able to do everything. And then you'll be able to see them together. And then in the next phase, we're actually going to go a little deeper on those example approaches that have been prioritized, and get into more of the questions like, what would it take to actually have this approach come alive, and who needs to be involved? So does that help set the context a little bit?
No, it does. I appreciate that. It was more of a comment that when I want to support number 1 and make sure we do those things, but to have the people on the ground level who are doing this on an everyday basis, it's important to get that data and provide that to
make sure that they're involved. Okay.
Yeah, more where I'm
wonderful. Thank you. Okay, Commissioner Mike Futrell.
Yeah, just briefly, and I do appreciate. I think all 8 of these are great. I'd love to do all 8, but I do appreciate what you just said, that we're going to have to focus if we're going to be effective. And I'm liking 1, 2, and 3, but I was agreeing. I raised my hand to agree with Liliana on 2 and 3, and particularly 3. Although I'm glad to have a county health clinic here, it is, for what we need, woefully inadequate. So I hope I'm not offending county. We need a new clinic, like Redwood City got a new clinic. We need a dental clinic here for low income. We do not have that. So I would like from this group is maybe we do some advocacy to, yes, it's great to have a clinic here, but it really needs to have all the services. And so you don't have to get on a bus and go down to Redwood City to get services, because our clinic here is small and old. But just wanted to add that. I know county wants to build a clinic here, but we're competing with every other priority they have. And we just need to raise our voices a little more, I think, to get that new clinic here.
So just to clarify then, is this, do you see that, we don't have that explicitly laid out, I don't think.
Well, when I see number 3, expand preventive and health
maybe
services,
number 3, that's what I was gonna ask.
i.e. dental. Dental's the one that got me, because we do not have a dental clinic here. And if you're a low income on Med-Cal and you need dental work, you literally have to get on a bus and go to Redwood City to get it done. That needs to change.
So maybe number 3 is part of both bringing more services to the local area and expanding or having a new clinic. So very specifically, we could add the language of in a new clinic to number 3, sounds like.
Because the new clinic is already being discussed by county, but again, we're being pitted against needs from every other city. We should make a push that we get higher up on the county list. That's all I'm pointing out.
Got it. Okay, thank you. Other responses? Commissioner Norm Faria.
Yeah, I just wanted to make an observation, and it actually will apply back to this list we're looking at. We identified on one of our first slides that we have isolated, identified areas where there's no one 14 or younger that speaks English. So there's communication issues. My question is how we can get to this part of our community so they're able to get the information on these programs when we get them, things like that. Is there anything out there? Because I think a lot of them in these demographics have no clue how to get to, or if they're even looking for it. So I don't know how we can pull that in to provide information and make sure it gets to them. Because a lot of them don't like to come forward and request help. So that's an observation that really kind of stuck in my mind. Making sure that we identify our shortcomings in getting information to those who may not have, the language barriers, or just don't want to get, they're scared to deal with society, for a better choice of words. That's it.
That's a very interesting comment. And before I go to Commissioner, the chair, I was just thinking, when you said that, number 8, develop and expand the community navigator or promotora program, that is a very well-established approach that actually, I think Commissioner Edith was part of the Community Collaboration for Children's Success when we identified that, as well as also Shrija, who just presented, highlighted that. So I think that is a promising practice that we could
Thank you. To
consider
build on what you
expanding.
said, you're exactly right. We can have all these programs, or 1 or 2 or 3 great programs, but if they don't have the information, it's futile. They can't take advantage, and that's a key element, in my opinion.
Thank you. Okay, so Commissioner, the Chair, how about?
Yes. So prior to the COVID, yes. Can you hear me?
Yes.
Can you hear me? Yeah. Prior to the COVID pandemic, and before we got sheltered in place, there had been initiatives from the city that we are connecting with places of worship with everybody who had been, because there's a level of trust. There's a lot of people also have immigration issues. So one specific example was our flu fair, or our flu health fair last October. We held it with the help of Commissioner Hermes Monzon. We held it over at the Boys and Girls Club at Paradise Valley. It took a long time before, and we distributed it to everybody. I know a lot of people from the Old Town group had distributed it to house, and we did a lot of reaching out. But still, there's a lot of people who are not comfortable to come out and get their free flu shot. And I arranged that with the Lions Club, and it's so nice that the Boys and Girls Club allowed us to do that in the Paradise Valley, knowing that that's the underserved population. And actually, for this year, we were planning to have it in the Furnicus building and another one closer to the Old Town. However, the county now has a different plan to do that. But, we have tried. There was also someone who told me, I think it was Olga Perez, who told me about the North County Peninsula Home Services. There used to be one by Linden, and it closed out. So we are thinking of some other ways to have the information close to where the people are. We try very hard to do that.
Mm-hmm. Thank you. Commissioner Edith.
Yes, I think while I was waiting, I think some of the things were already mentioned, but I definitely wanted to comment from Commissioner Norm. I think it also has to do, it's been mentioned, the language barrier, also being undocumented. That creates a lot, even if it's for medical or, something that there's basic needs. The trust is not there. You're really scared of that part. Also the time limit. Some people have 2-3 jobs in order to just, have basic needs, met. Childcare needs also, the time, to where they're going to leave their kids, they come back from work, they have their kids, and the ability to get out there and get this workshops or meetings that are set up in the community through CCCS. When I participated, definitely that was one of the key barriers. This different areas that I mentioned, some people were not trustful of because they knew maybe it was government or the cities. So I think promotores or people who are trusted already in the community and speak the language are going to be the key people to support, distributing this information that Commissioner Norm was talking about.
Right, and again, specifically, that's number 8 that you just outlined. Thank you. It looks like there's some agreement there. So I think I'll take one. I haven't heard from Commissioner Pat yet, so I'll take your comment, and then I'm going to move us along, if that's okay.
No problem. I'd just like to advocate for number 5. I think that can kind of be tied into number 3, investing in the mental health and wellness programs to promote real safety and healing for South City kids.
Thank you.
Thank you.
Okay, maybe, are there quick comments? Can I take quick comments before we move on? So Commissioner Hermes.
Yes, thank you. Yeah, I have a lot of comments, but I'll try to be short. One is that we talk about programs on the neighborhoods. I would like to know which programs are active right now, specifically in Old Town with our teenagers, or any other program that I would like to know if they are active. The other question is how we can bring this, what we're discussing, actually to the floor, to the street. Thanks to the council member Floor, last year we had a successful opportunity to bring this free flu shot, and Brittany and Dana from Old Town. And that was success, but we don't have a place where to do it. And I would like to encourage everybody here to advocate for a community center for our Old Town, where is a lot of inequality in this area, and how we can bring actually all what we're discussing to the public. I've experienced myself that it's hard to bring together people, and a lot of comments that I hear here that trust is, we need to regain that's from the community. But let's start with a community center park, so we can bring these programs to the areas that are more needed. And I think I heard here that Old Town was one of the areas, and whichever other area are needed, but can we work to something physical? I would like to see, or we would like to see something physical, how we can bring something physical. For example, if we have a program tomorrow, we don't have.
So I'm just going to interrupt a little. I think what you're saying, and there seems to be a lot of agreement. So maybe, Paige, what we could do is go to the next slide and add one of the ideas. I think is to have a community center or a community resource center. And that would be an additional approach that we could consider. Does that capture what you were saying? And particularly in, we'd have to figure out where, but one of the recommendations was Old Town. Okay.
Yes, I think it's all very clear that
Thank you.
A lot of Old Town. Thank you.
Thank you. And I appreciate that people are already brainstorming about how that could be funded. So what we're going to be doing is looking at all of your comments and considering those. And then, just going back to the other slide, so just back one slide, Paige. I heard folks talk a lot about 1, 2, 3, 5, and 8. So just to track that. We're not making any final decisions today, so that's okay. And then we just heard on the next slide, the idea of creating something concrete. That's what I heard. So like a community center, something concrete. What we're going to do next is we're going to move to ask a question, which is, we heard in our last meeting that, and I think Paige mentioned this earlier, that you're interested perhaps in not just thinking about these ideas in the time frame that we've proposed. And, even though from some perspectives, this is a pretty fast time frame to cover a lot of topics and really dive in, we heard really clearly that you might want to move more quickly on an approach. So our question is there one or two that you would like to vote on right now to move forward to further investigate sooner as opposed to later? So that's the question on the table. Is that clear what the question is? So essentially, we've just talked about a lot of approaches. We're not narrowing today. We're going to keep going so that each meeting we're going to talk about some of the context and some approaches. But we did want to honor your request to consider moving one approach for further investigation sooner as opposed to later. So Paige is real-time editing, thank you. And Commissioner Mike Futrell, did you want to add something to that?
No, I wanted to comment if you're ready for comment.
Oh, please. Oh, okay.
I don't
and then I'll take Liliana. Okay,
yeah,
go ahead.
I don't want to slow any of these down, but if I look at these, the ones that might have traction to actually get started sooner than later is approach number 1. I think because of this whole issue of police and their interaction in mental health crisis nationwide has really created an opportunity, I think, for us to get to county and maybe get a pilot program going. And I think the time is right to go after that. Now, they're all great. We should attack them all. But I think that one has legs right now because of the national dialogue.
Thank you. I haven't heard from Commissioner Bobby, so I'm going to take you next. Go ahead.
Yeah, my comment would be, so with a little bit of perspective here, stepping back, I'm thinking about something that I said during our first meeting, which is, I think a lot of these approaches are very good approaches to solving social problems. My concern or question is, are they approaches to eliminating racial inequity? So while they are clearly great ideas and they serve the needs of the people, I just want to make sure that we're foregrounding the reason why we're working on this, which is because we are trying to address systemic racism. And so the approaches that highlight an acknowledgement of racism are the ones that, you know, to me as a member of this commission seem most appealing, like the promotores, which is clearly trying to address systemic inequities from one community, a racialized community, to the broader community. So those are the kinds of things that, were they to be expanded upon and given more life, would not only help those in need, but also serve to communicate to the world that South City is actually taking on issues of systemic racism. So, and number 1, clearly I'm fully supportive of approach number 1. But I think it should be discussed in a way so that it draws attention to the issue around racism. That's why we're talking about it, not simply because it's a good social service, it's a great idea, but that it actually can address a systemic racial problem. So when I look at all of these, I just want to kind of encourage us to, one can provide these services in a racist way, and we don't want to do that.
Thank you. That's a great point.
That's a really good point. I think that we should, something that can be done.
Maybe just a brief comment, because we just have 7 minutes left, and I want to see if we have enough interest in a vote. Did you want to make a quick comment, Liliana?
Yeah, I was just going to thank Bobby for that comment. And I think something that we could do to stay focused on that is to have the city immediately move to announce that no city program or service will ever be off, or you'll need to show documentation or residence to receive it.
So that's maybe another idea that we can consider. Okay. So I think, I'll just say one thing, and then I'm going to put this to vote and see if there's interest in moving something forward sooner as opposed to later. That's all that's on the table right now. I think what we want to think about is, again, approaches that align with existing momentum, like we've heard, and I think that any of these approaches, to the point that Bobby and Liliana just mentioned, can be focused further to really be explicit about the fact that we are here to address systemic racism. So I think that that can be done as well. So with that, let's go page 2.
Hold on, are we only focusing on 1 and 8? Because I've heard a few people speak to that. I just wanted to know before we move on if we're considering all of them or if we're just considering 1 and 8.
So it sounds like, based on today's conversation, and it's not the only time we have this opportunity to have it, but for today, because we're at Health and Social Services, it sounds like there's the most momentum around the 1 and 8 for now. And then we'll come back to this and consider the rest of the approaches alongside the other approaches that we'll identify from the other topics. Is that okay? Is that clear?
Any strong objections? That works for me, but I'm not in the commission, so.
So we're thinking about 1 or 2 approaches to fast track at the moment. Okay. And then if these don't get fast tracked at the moment, they'll stay on the list, and we'll go back to these at a later point in time after we've had a chance to look at the other example approaches from the other topics. Does that make sense? So this is, again, just an idea of fast tracking. So let's take approach number 1.
Hold on, so backing up to process.
We've got 3 minutes, so we're going to have to go quickly, but it's 1 or 2 approaches that we're considering. And if you are interested, then if you approve, then you click to raise your hand. And if the majority approves, then we'll move forward, we'll fast track and begin investigation. So we're considering right now approach number 1, and we can modify the language to be very specific to address systemic racism.
At point of order, can we vote for both, or do we have to pick one of the other or the other?
Thank you for asking. You can vote for both.
Okay, thank you.
So right now it's really just based on the conversation. Yeah.
1 at a time.
So 1 and 8. Yeah, 1 at a time. So we're looking at hands up to support fast tracking approach number 1. I have 14 commissioners. Are those all commissioners? Commissioners voting.
All but 1.
Okay. And so I'm sure we're doing some screenshots to make sure that we're tracking all of you. Thank you, Nayeli. And approach number 8 is up next. And again, this is
Hold on, I'm going to lower everyone's hand first. 1 moment, sorry.
Yes,
make sure we
good
don't
point.
accidentally get.
Thank you.
Okay, everyone's hands lowered, and now you can vote on 8.
Thank you. So this is, right, expanding the community navigator promotoras to address, to ensure that services are culturally appropriate and brought to where people are. So I'm seeing 15 hands. And so we're asking for commissioners' votes only.
Great. And
wow,
both overwhelmingly pass. We'll include the final results in the minutes.
Okay. Whew. Okay. Well, with technical problems and with all of the competing priorities, I just want to say again, thank you so much for everyone who joined today. We are going to be staying for public comment, so I just want to mention that. But I think Chair Nicholas you're going to hand over the chair position to another chair because you're going to have to leave for a commission meeting?
Yes, we will designate the Board of Trustees President Pat Murray.
Thank you.
Thank you.
So
Okay.
we're moving on to public comment.
Thank you. And I know a number of folks have to leave, but I also will be staying on to take public comment. And so our first public.
Sorry, I will stay on as long as I can, but I also have to leave for our council meeting, but I want to stay and listen to as many public comments as much as I can. So just wanted to.
Oh, wonderful. And I think Mike Futrell, yes, Commissioner Futrell.
I will also join Commissioner Nogales for a few minutes.
Thank you. Okay, so anyone from the public who would like to raise your hand, we are available to hear you. This is your time.
And to clarify, so everyone who wants to speak, some people are raising their hand. I just want to make sure you have to raise your hand. We'll call on you and unmute you, and you'll be able to speak in that order. And then Kim, do you want to just, I've been coordinating things, so I'm wondering if you want to summarize any of the chat comments throughout, kind of high level. I know there have been various questions, some of which have been addressed, but if you want to attempt that.
Sure, I'll look at that. And then you're going to look at any public comment interest? Okay, great. Uh-oh, wait, where we go? Let's see, so do we have a first public comment?
One moment. Okay, AS, logged in as AS. I just asked you to unmute.
Oh, hi everyone. This is Olga Perez. And yeah, so I grew up in Old Town and my children was raised in Old Town as well. And during the tragic murders back in 2010, there were community members from schools, the city, our church organizations. I went in as a parent and as a member of HOTRA organization that existed in Old Town in the area. So we all, and then students were there, parents were there. And it was just sad that, it came to that for the community and all these organizations to come together after the fact. There's a lot of barriers that exist in Old Town. There's a lot of, social inequalities, and that's what, and racial inequalities that I want this commission to focus on for these students to have those opportunities. If we combat these problems or these barriers at home, they won't be carried on to the schools in order to have, with these issues with the police department, resource officers being present at the schools. Thank you. Sorry, I'm short for time. Right.
Thank you so much. Appreciate you calling in. Paige, is there someone else?
Yes, Eddie, I will unmute you, and followed by, I apologize, Aristel De La Cruz. So Eddie.
So Eddie's up next?
Yes, can you hear me?
Yes.
All right. So first of all, thank you for taking my public comment. I appreciate this public forum. And I just wanted to say, kind of a note on kind of Chair Councilwoman Nicholas said at the beginning, not to comment on politics, but our health and our social services are.
Sorry, I apologize. I just tried to put your hand in, and I absolutely accidentally hit mute.
All right, can you give me some more time back, please?
Yes, I will.
Okay, thank you. So getting back to what I was just saying, our our health and our social services are a direct result of our elected officials. So speaking about who our elected officials are and the politics of our city is in line with this public forum. So I don't think that that's an off-limit topic.
No.
And then getting into my comment that I want to talk about today specifically, I'm just a little concerned that whenever we have these discussions, there's a need to have the police department voice inserted in all aspects of the city. This is a discussion on health and social services, not policing. Social services and health are carried out by professionals with bachelor's, master's, and even PhD qualifications. When we were talking about the police's qualifications, it was 1 week cadet training, on-the-job training. This is nowhere near the scale and the breadth of what a medical and a mental health professional has. So, and then another thing, why aren't we hearing from people in the community, like Nagal has brought up, that are engaged in this work? Why are we spending time listening to the chief defend the status quo when the whole purpose of this commission is to question the status quo and to find ways when the status quo is not working? So I don't think we need to spend any more time defending what services we have when the whole point of this commission is to confront racism and equity. And Chief Azzopardi really quickly mentioned the problem is economics, and he's right. The average compensation of a police employee is $234,000. $234,000. And so we constantly say we don't have the money and we defer to the county, but why can't we shift our money and create a task force that are actually mental health professionals? And I see my time's up. That's all I have. Thank you.
Thank you very much for your call. I appreciate it. And Paige?
Aristel, you are next.
Okay, Arisa?
Can you hear me?
Yes.
Arisa, yeah. Mm-hmm.
Yes, I'm an educator. I work with children and families in South City. Just two things here. So my understanding is that these meetings are immune to Brown Act violations. I would suggest, and I would like for all the council members to be here. That way we can get some direct answers and things don't, get funneled in and filtered out. I think this would be ideal given how much work we're getting done in this particular meetings. And if we're not violating Brown Act, there should be no reason for us to have council here altogether so that we can really move on making these meaningful decisions around racial injustice. Second is, my question is, what is the measurement in which council and this commission is going to grant statements like, we are only trying to get homeless and addicts help from the chief of police when the data presented or that is readily available is very limited. So when you look at meta-analysis, peer-reviewed research, and national surveys around these issues, we've seen that incarceration exacerbates addiction and mental health. I did not see any evidence all we got was like, we don't do those things. We don't arrest people. And I don't know how much weight we can put on that and how much credibility we can give that when a lot of the data has proven otherwise, when there is a conflict of interest. Like what happens if they stop someone who's homeless, who might be an addict and they have possession of an illegal substance? Are we gonna incarcerate that person and then exacerbate the addiction that the person is having? How can we ensure that SSF PD is operating in good faith and that like officers are not just trying to make an arrest in order to climb and promote their careers or to get good performance reviews? These are conflicts of interest that I don't think officers should be leading the way in terms of addressing mental health and homelessness.
Thank you, Arista.
I'm wondering, Commissioner Nogales, I wonder if you just want to speak to the Brown Act, that would be a conflict actually.
I would refer to the city attorney's statement. And I think both Paige and Kim have both mentioned that previously. I'm happy to.
Oh, no, sorry, apologies. I wasn't clear. So, right. So yes, the city attorney clarified that the commission is not under Brown Act, but part of that is because there's 2 council members who are serving on it, not a majority of the council. Whereas if the majority of the council were to attend and participate, then it would be under the Brown Act and would be a conflict Does that make sense as a clarification?
Right. So we're not bound by the Brown Act, but we are wanting to make sure that the meetings are open and public and participatory. So hope that clarifies that. And Paige, who's up next?
Jennifer Garstang is next, and then followed by Marcela Rivera.
Okay, Jennifer.
Hi, can everyone hear me okay?
Mm-hmm.
Yes.
Thank you. I just wanted to speak to one thing that I was noticing. I think that the approaches that you guys are coming up with are extremely important and very valuable. But one thing I would like to advocate for is a higher level social and racial justice plan that can be incorporated as one of the plans referenced by our general city plan. Something that looks at every aspect of our city's development and how it's run, the services provided, and has a plan for in each of those areas how we are going to close the gap, lift all boats, and move forward in the over the long-term scale as well as in the short term. That's all.
Can I ask a clarifying question? So are you thinking in the general plan or like a commission that oversees?
What I'm envisioning is something like we have, as part of the general plan, there's a climate action plan, for instance, that the city is required to create, and several other plans along those lines that inform everything that we do within the city. And I would like to see something similar. I don't know, I don't have an opinion on exactly what form it would take, as long as it was comprehensive and applied to literally every aspect of our city.
Got it. Thank you. Okay, Paige, who's up next?
Can I touch on that really quick? I
Yeah,
believe,
please.
I could be wrong about this, but I believe that there is state law that requires us to look at that in terms of potentially the general plan and also our departments. But I could be wrong. I know we've had discussions about this, but I'm happy to look into that more.
Wonderful.
Mark, I'll add.
Yeah.
We are adding a new social justice section to the general plan, and certainly want everyone to participate as we write that over the course of the next 12 to 18 months. And the work of this commission will absolutely influence that. And both Paige and Kim are part of the general planning process. So there's going to be great collaboration, I think, between this effort and the general plan. And for those that don't know, the general plan is the city's 20-year strategic plan. So it's very important that we include elements of social justice and social equity in that plan, because that's really going to embed it into the city's DNA into the future. So I thank you for raising that, Jennifer.
My pleasure.
Next up is Marcela Rivera, followed by Russell.
Marcela, do you want to go ahead and unmute? Okay, we can come back to Marcela. How about Russell? And then I see
Hello?
Myra.
Oh, is that you, Marcela?
Can you hear me?
Yes. Marcela, I could hear you for a second.
Hello?
Yes.
Okay, awesome. I think that I have a few things to say, but one of them I would like to address is the lack of mental health and counseling going on in our schools. I think that the ratio of counselors to students in our district is not really adequate for the kind of services our students need and the kind of support we need. So I think a way to combat this is to, maybe take some of the police out of schools who supposedly serve as mentors to our students, but actually have been shown to harass our students from public comment and just community stories. And I think that this is something we need to look into, especially with the school district. Furthermore, I think that I've been to a few of the SHAPE SSF meetings, and it's awesome to hear that you guys are on the committee for that too, and helping with that. But I think in regards to Old Town, I went to the meeting that happened, I want to say Monday night, And heard a lot from the community that there needs to be more green space and community centers in Old Town, and really helping those communities and giving them the resources to have like a healthy life and build the community, I guess. So another thing I noticed in this meeting, I felt like there was a lot of finger pointing about who's responsible for what when it comes to like budget and mental health services. You know, we had people from the city saying, oh, it's the county, and then as a party saying, oh, it's like the state's problem. So I really think that, you know, maybe it is someone higher up's position to make those decisions, but I think we need to have our city leaders really pushing the boundaries and trying to understand these rules and regulations that are going on, and really advocating for the city. And you hear what we want, and I think if it's not really your responsibility, you need to find someone whose responsibility is to come help your community when they're asking for it. Okay, that's all. Thank you.
Thank you very much.
Great. Russell, you're up.
Hello. Thank you for letting me speak. I already typed my questions into the thing as like a form of reference, but like to read them out, like as pertaining to the liquor store statistics for SSF based on, I guess, demographics, like how many liquor stores are relative to which, I guess, ethnic groups. Like, is there one that I guess addresses like grocery stores? Because as like some of us like me know, like food deserts are a form of systemic racism that directly ties into public health. Like food is one of the, I guess, strongest, I guess, like indicators or like strongest reasons for like bad health or good health. And most county residents and Americans get their food from nearby corner stores and fast food. And for a lot of children rely on free or reduced lunch, our school lunches aren't too much better. I remember when I was at El Camino High School, Burry, Altaloma, our lunches would be like pizza. Like it would count for a lot of different like food groups. That like one pizza slice, there would be like a pack of carrots, and there would be a little carton of chocolate milk. And for a lot of children, that would be their one and only meal for the day, or like their only like one of their only meals for the day. And I was wondering if like there could be, I guess, like if we could address public health inequalities in food accessibility in South San Francisco, if we can somehow like cooperate between like the school district, the city, and the county, and figure out how to address these on a systemic level, because there are a lot of people who, like as we see in like the drastic I guess difference in like life expectancy in our county and our city, like which could be, I guess, addressed through food. So thank you.
Thank you. I'll just add, and I think maybe Myra's up next. So before that, someone asked about if we're having a meeting specifically about housing, and we are. So, and I also will say that the comment about education, we're also going to have a meeting on education as well. So we're going to be kind of taking comments and bringing data back to you related to that, related to specific topics. So who's up next, Paige?
I think Myra first, and then followed by Gustavo Lopez.
Okay, great. Let me move. I can't see the clock. Okay. It seems to me Bobby's comment, and I'm looking at the others who are in agreement with it, would suggest that maybe there's something to look at in creating an action item approach that is actually a racial lens for everything that's done. So in other words, it would be its own thing. That racial lens would apply in housing, it would apply in policing, it would apply in mental health and social services. So maybe that is actually, maybe that can become yet its own thing. And then that way it can be applied to every other area of the city, every other general item, and that can help in terms of staying on point and on focus on equity.
Thank you, Myra. Who's up next, Paige?
Gustavo Lopez.
Hello, good evening. Thank you for having me. I wanted to speak on, to kind of echo some of the statements made. It is unfortunate that every single time we're talking about finding services for our community, you know, the police are given a platform to kind of push their services that actually the data shows has a horrible track record, right? A lot of their services trying to prevent kids from using drugs or alcohol are very outdated. They come from the Ronald Reagan era of Say No to Drugs, the DARE program, which has really been a waste of money through the years, and the data shows that. But what does work is quality long-term interventions, right? Specifically, you know, violence prevention programs, wellness prevention, wellness intervention programs, therapy, counseling, peer and case management has seen a lot of positive outcomes. I think of case examples of San Francisco. San Francisco has wraparound services for many of their young people. Young people have access to case managers, they have access to therapists and counselors, they have after school programs. They also have the wellness centers in San Francisco. Every school has a wellness center where every school has a nurse and a therapist in a lot of, in majority of the high schools in San Francisco. I think of Redwood City with Sequoia High School. They have a teen resource center. They have 3 therapists. When I used to work there, they had a therapist for formerly incarcerated young people who are on probation. They had a therapist for Pacific Islanders. And then they just had a general therapist for the general population. And through that teen resource center, they were able to provide services. CBOs were able to go in there. It was very rare that I saw police on campus. They also had after school programming where students could do yoga, they could do DJing, they could do all these other things. And I wondered back to the students, when I was a former teacher at South City High School, my students didn't get services till they were incarcerated. It wasn't until they went to juvenile hall that they were able to have meditation, they were able to have one-on-one tutoring, they were able to take all these different classes. So I just say the examples are there, and we shouldn't lean on the police. They're way too expensive. They make way too much money. They're just too expensive to provide services that they're not equipped to do. Thank you.
Thank you, Gustavo. Paige?
Next
Who's
person
up
is
next?
someone who called in, phone number ending in 2442.
Hello.
Yep, we can hear you.
Hi.
Oh, hey, this is Patricia Hurtado. So just to piggyback off of what the just to piggyback off of what the last caller was saying. And to address concerns and comments made by a lot of the commissioners and previous public comment, specifically in regards to delinquency. So delinquency is caused by antisocial behavior, which comes from untreated mental health conditions, basically derived from familial environment and genetics. And a way to go about that is through community policing programs. However, they have to be quality and evidence-based, which includes prevention, intervention, also known as diversion, and treatment programs, something that the department has never offered. And I think something the last caller said too was like programs from the 90s, which is absolutely correct. DARE, which I went through when I was at Bury, and then now they have GREAT. These are free programs, and I'm sorry, but you get what you pay for, and they're not addressing the problem. So yeah, that's all I wanted to say.
Thank you. We have a few others.
It looks like those are the only non-commissioners who have their hands raised.
Okay. Well, we are over time, so maybe what we could do is take a few more commissioner comments and then aim to be wrapping up shortly.
So commissioners.
Let's see. I think Gladys, Commissioner Gladys, and Commissioner Liliana. So Gladys, would you like to go first?
Yes, my question is, how do we, I mean, I'm a little bit frustrated with this process. I felt that a lot of what I heard is their responsibility. We don't have to do anything. And there is a lot of community input, and how are we going to take that input that is very valid. So what is the mechanism to include that?
I think I can try that, and then others can join in. So again, many of the approaches that we brought forward today are actually based on Change SSF's recommendations and also the Community Collaboration for Children's Success recommendations. And those, I think, both reflect quite a lot of community engagement. So we wanted to bring that to you to be able to build on the work that's already happened in South San Francisco, in addition to gathering your input today. So we're happy to take more questions about those approaches and why we chose those approaches. And we're also, trying to think of ideas that, or approaches that have traction. I think that was one of the ways that somebody mentioned it, but that really both address systemic racism and also are achievable. So we're trying to balance all of those things. I think Commissioner Liliana was next, and then Commissioner Kayla.
And actually, we have one more, or at least another public comment. So James Coleman, before we go back to the commissioners.
Okay.
Hello?
Yes.
Can you hear me?
Yes.
Go ahead, James. Yeah.
Okay, cool. Hi, my name is James Coleman. I'm a lifelong resident of South City and also a candidate for City Council in District 4. First, I'd like to thank everyone for their involvement in the commission so far and the incredibly insightful comments that were made during this evening. But I want to stress the importance of the level of education attainment in our community. This is, in regards to like item number 4, I mean item number 5 that was previously in the presentation. Research shows that communities where education is more accessible translates into communities that are less vulnerable to poverty, unemployment, and crime. And down the line, this leads to reduced need for public spending on remedial education, criminal justice, and social support programs. And South City is one of the few cities that has its own preschool program, and I was actually one of the lucky children enrolled in it around 18 years ago. But the city's current pre-K waitlist is 3 to 4 years long. And looking at the demographics of the city, that waitlist only stands to get longer. This lack of access and affordability is absolutely unacceptable and a massive equity issue in the city. Universal pre-K and educational after-school programs for children of all levels is an increasingly sensible investment. And I hope that the city can work with the Parks and Rec Department in the city to expand these resources. Thank you.
Thank you. And again, Paige, you have the meeting topics showing on the slide here. I think it's good for us to all remember there's a lot to cover in each topic, but we will have public safety and policing next, education and economic development, where we'll be able to explore the topics related to education, housing and affordability, and then another meeting probably to narrow the topics. So, Paige, are we back to the commissioners? So Liliana? Okay, go ahead.
Thank you. I'd just like to say one thing related to the suggestions that Myra and Bobby made in terms of therapy and like mental health services, is that I definitely think that that can for sure be done in a racist way, right? Like our schools are mostly children of color, so if they walk into a therapist's office of only white therapists, I don't think it's going to be very helpful, and it might even deter them from seeking more services if they're talking to somebody who doesn't really understand what they're going through. So I'd like to see maybe like a grow your own program where we could have former students come back after getting, some sort of therapy licensing, because those are the ones who know the issues that kids are facing. And another thing is that I would like to propose relating to, not wasting time talking about the current status quo. I know next meeting is about public safety and policing. I don't really think we need another presentation about the current situation. We already know it's not working the way we want it to be. So I propose that we use that entire meeting just for alternatives.
Thank you. Commissioner Kayla.
Yeah,
Couple of logistical questions I have. One is, can the commissioners receive the slides with the alternatives a few days in advance? I just felt like the conversation today was a bit rushed, and I would have appreciated just like more time to think about them and which ones to prioritize and better questions to ask. And then two, is there a way for the commissioners to get like email addresses or something so that we can discuss with each other? Community members can like email us if they have follow-up questions on what we say, just something like that, just to open up the communication lines.
Thank you. We will definitely follow up on that. Okay, well, it's 6:30. I don't see any other hands. So we wanted to make sure that you know the meeting topics that are coming up. And for the commissioners, one of the things we had asked and offered was to have conversations with you, speaking of opening communication lines. And because this process has kind of, you know, been running out of the gate since we started it. So apologies for not sending you the slide deck in advance. We've been working madly on getting it ready, and I have a feeling we'll be doing the same for the next round. But I do want to, you know, invite conversation, and I think that's a really important idea. So we'll be following up with you, those who are interested in having a conversation with us, and look forward to continuing the conversation on September 2nd. We'll be getting out some meeting minutes of this, today's meeting. And I guess I just, you know, in looking at the chats and hearing your conversations, I really appreciate how thoughtful people are and engaged and really trying to make sense of a really complicated landscape. And also I'm noticing, I mean, I think that we can disagree, and I feel like that's what's happening, is we're able to sort of say what's on our minds without kind of, you know, with the intent of being understood. So I really appreciate that approach. So we will take your comments as, you know, we want to try to create a landscape and understanding so that we can make good decisions together. And I think with that, it's 6:32. So I think, Paige, we need to formally adjourn the meeting, right?
That is over to
interim
me. Chair Murray. Exactly.
Okay. So first,
Murray.
I want to thank Kim and Paige for your thoughtful work. I mean, it's really nice to be guided in this process, and I think it helps everybody stay on the same page and really focus on what each of us thinks is important, coming up with consensus. So thank you. I appreciate it. And with that, I'll adjourn the meeting.
Bye, everybody.
Bye.
Thank you.